at the end of last year, New York State enacted two new policies on race that were theoretically progressive, but potentially counterproductive. The first is that New York is now treating race as a medical risk factor when it comes to determining who's eligible for new COVID antiviral treatments, which are currently still in limited supply. A December 27th memo from the New York State Department of Health instructed healthcare providers in the state to prioritize patients for antiviral treatments based, of course, on the usual factors such as testing positive for COVID, exhibiting symptoms, and/or having a medical condition that increases the risk for severe illness or hospitalization. However, the memo also added, quote, non-white race or Hispanic/Latino ethnicity should be considered a risk factor as long-standing systemic health and social inequities have contributed to an increased risk of severe illness and death from COVID-19. So naturally, when right-wing outlets got wind of this new race-based criteria, they had a field day. The New York Post has covered the Department of Health directive multiple times over the past few weeks, including publishing an editorial titled, "Racial Medical Care is Careless and Racist." Likewise, Fox commentator Carol Markowitz tweeted, quote, New York State Department of Health warns they don't have enough Paxlovid or monoclonal antibody treatment, and white people need not apply. And then, of course, Tucker Carlson was also on the case.
This is not healthcare. It's punishment. It's punishment meted out on the basis of skin color. Now, the justification for all of this, and the authorities could not be clearer about it. They've taken their ideas directly from America's colleges. They'll tell you why they're doing this. The justification is history. The United States has mistreated racial minorities in centuries past, they say. Therefore, whites must suffer now. So your ancestors did bad things, or people who looked like your ancestors did bad things. So now we're withholding medicine from you. They call this equity. It's not equity. It is collective punishment. It's the North Korean standard. It's the definition of evil.
Now, pissing off the right would obviously be well worth it had we actually been able to implement some kind of substantive healthcare reform at the state level, say a single-payer healthcare system. But in this case, it's a shame that the right seems to have the monopoly on criticizing this recent Department of Health memo because there's literally no upside to New York's designation of race as a medical risk factor, and no one should defend it. Yes, we know that racial disparities in COVID infection and death rates have existed since the start of the pandemic, but let's be clear, treating race itself as a medical risk factor, even in the service of anti-racism or trying to ameliorate racial disparities, is not only a potential legal quagmire, but also essentially constitutes what the historians Barbara and Karen Fields call racecraft. In the context of COVID disparities, race is largely a proxy for poverty, socioeconomic status, and the segmentation of the labor market. For instance, we know that Blacks, Latinos, and Native Americans have been more likely to contract COVID and require hospitalization, not because of some special racial DNA, but because people in these groups are more likely to be frontline and/or low-wage workers, more likely to live in low-income neighborhoods, and of course, more likely to have grown up poor. We also know that living in poverty makes people more likely to have certain health conditions that make them vulnerable to COVID, such as high blood pressure, heart issues, and diabetes. So the problem is that when you use race as a shorthand for all of the above, as liberals have sadly done since the start of the pandemic, you start to perform racecraft. Racecraft, as Barbara and Karen Fields define it, is a sleight of hand that A, reinscribes race as a natural and self-evident category, and B, obscures class. I've discussed this on the show in the past, but I think it's worth repeating here. One striking example the Fields use to illustrate how the process of racecraft works pertains to racial health disparities, much like the discussion we're now having around COVID. As the Fields have written, in the early 2000s, a group of researchers looked at rates of asthma among kids living in the South Bronx. So this neighborhood, which is one of the poorest parts of New York, is incredibly polluted as a result of heavy truck traffic, the presence of a sewage treatment plant and several waste transfer stations, and its close proximity to several highways. Given all of that, it's probably not much of a surprise that researchers found that as a result of the unhealthy levels of air pollution in this low-income neighborhood, kids in the Bronx had very high rates of asthma. As the Fields have put it, it would seem clear as noonday that class inequality had imposed sickness on these American schoolchildren. However, when the results of this study were covered by the New York Times, they were written up like this. Quote, Dr. A. Hal Strelnick said the borough's high rates of asthma stemmed from a high concentration of traffic in a densely populated area, poorly maintained housing in impoverished neighborhoods, a lack of access to medical care, and a large population of Blacks and Hispanics, two groups with high rates of asthma. So, the last line of the summary, which says that asthma rates are high in the Bronx because Black and Hispanic people live there, transforms asthma from something that you get because of your external surroundings into something that you have because of your race. This is exactly the obfuscation that the New York Department of Health has performed by saying that race is a medical risk factor for COVID, even if their intentions may have been noble. An affluent Black or Latino person who's young and in good health and able to work remotely is nowhere near as susceptible to COVID as an older, low-wage service worker with hypertension and asthma, regardless of whether that older worker is Black, Latino, or yes, even white. To suggest otherwise is not only unnecessary catnip for the right, as we've already seen, but also papers over the fact that many of the real medical risk factors for COVID are the result of class inequality. And as it happens, the Department of Health's new designation of race as a medical condition is not the only recent example of state-level so-called progressive racecraft. At the end of last year, New York Governor Kathy Hochul signed a bill requiring state agencies to disaggregate data on different Asian ethnic groups in the state. Anita Gandana, a director of the Coalition for Asian American Children and Families, told NBC News, quote, "This is groundbreaking. We started with this need for better data on our communities because so many of our community members have been struggling in silence." So, data disaggregation has been a policy goal of progressive Asian advocacy organizations across the US for a while now. These groups have been pushing to pass these types of bills in several states with large Asian populations. Why are they so interested in this data? Let's look at one standard explanation.
Another shortcoming is the way statistics get aggregated under the broad term Asian American. Let's take a look at a very common stereotype, that all Asians are crazy rich.
The crazy rich Asian stereotype makes me feel really broke.
I can say with a complete authority that the crazy rich Asian stereotype has never really applied to my lived experience.
Myself as a Pacific Islander feel like I am wealthy and spiritual, in the spiritual sense, though, which, that's special unto itself.
On paper, it seems like we're doing pretty well economically.
But when you expand on that data, you'll see that the wealth is concentrated among select racial groups, mainly Indian, Filipino, Chinese, and Japanese Americans. And when you look at the other end of the spectrum, you'll find Burmese, other Southeast Asian, and Pacific Islander communities.
It's important to disaggregate data because we are deemed insignificant and we are deemed too small to be a community on our own as Native Hawaiians and Pacific Islanders, or NHPI.
Lao Americans, majority of them who came to the US, are refugees. And it is the impact of American engagement in Vietnam that brought me here to this country.
What the data hides is the fact that many Southeast Asians arrived in the US as refugees. It also hides the fact that the Pacific Islands, like Guam, the Mariana Islands, and Samoa, are still territories of the US, which function like colonies.
So I'll admit that I too used to be a supporter of data disaggregation. And I still think on the whole, yes, it's probably better to err on the side of more data rather than less. But I also think it's important to look at why, at best, this disaggregation is not the brilliant fix that so many liberals think it is, and why, at worst, it sometimes functions as another low-grade variant of racecraft. It's true that when you break down income and wealth by different Asian ethnic groups, there are some pretty stark disparities, as we just saw in the last video. But let's look at some of the policy solutions favored by the proponents of data disaggregation. Here's one example offered by an article in the Brown University Political Review. Quote, despite the fact that only 14% of AAPI lack health insurance, this statistic can be disaggregated down to 8% of Japanese Americans and 27% of Korean Americans lacking insurance. Without this information, it would have been difficult to argue for a campaign to increase rates of insurance among AAPI. With this information, policymakers would have the data they need to argue for a targeted campaign aimed at Korean Americans. So, okay, sure, fair enough. Lumping all Asian ethnic groups into the same bucket hides a number of disparities. But the policy solution offered here as the result of this so-called better data is, I think, pretty instructive. Let's put it this way. When it comes to healthcare in America, do we really need a targeted campaign aimed at increasing health insurance for Korean Americans by a few percentage points? Perhaps what we actually need is to overhaul our incredibly broken healthcare system for literally every single person in the US, preferably through Medicare for all. Likewise, do we really need to close the median income and wealth gap between, say, Indian Americans and Burmese Americans? Or do we need to close the income and wealth gap between the billionaire class and everyone else? I'll bring up just one other example of the limitations of so-called data disaggregation. Proponents of data disaggregation often point to the Chinese as an example of a high-income, successful Asian ethnic group whose good-on-paper statistics end up overshadowing other Asian ethnic groups. Well, as it turns out, in New York City, a sobering 45% of Chinese residents earn an income that's 200% below the poverty line. Of course, New York City is also home to plenty of Chinese millionaires, including, to name just one, the designer Vera Wang, whose net worth clocks in at $500 million, according to Forbes. In other words, there are also obviously massive economic disparities within Asian ethnic groups and not just between them. Just ask the low-wage Chinese workers at the New York institution Jingfang, whose wages were routinely stolen in the 90s by their restaurant bosses, who were also, you guessed it, Chinese. Or ask the Chinese home care aides who were forced by the social services provider, the Chinese American Planning Council, to work 24-hour shifts for poverty wages. So you see the problem here. Asian data disaggregation can give us some very limited information on trends by ethnicity, but has nothing to say whatsoever about class or economic inequality. The point here, of course, is not that data disaggregation is a bad thing in and of itself, but as a tool for crafting public policy, which is what it's intended to be, according to its supporters, data disaggregation begins to look very much like an avenue to nothing more than skimpy technocratic tinkering. Just like saying that race is a medical risk factor, it's also a lazy shorthand for talking around the economic forces that create poverty, poor health, and bad jobs, instead of addressing these economic conditions directly. Or, to put it more bluntly, it's just another way for liberals to talk about anything but class. If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.